It's the Love Goddess Show, the one show on Earth that is all about relationships. The Love Goddess's earthly incarnation is Dalma Hine, psychotherapist and best-selling author of 3 books on love.
Welcome back to the Love Goddess Show. We are so happy to be here and so happy to welcome you. We have a great show tonight. Then we have a special guest, Dr. Mara Tabares, a Danbury chiropractor whose work is so interesting, and she welcomes her patients the way I want all our viewers to be welcomed by anybody they go to see, because you have to have that kind of care in your life from everybody. Now, has to say, welcome to the show.
Thank you. Thank you for inviting me, Dalma. It's a pleasure to be here.
So when somebody comes to you and says, I don't know, what's the matter? I'm exhausted and, good luck. What do you see? Where do you begin? How does it work for you?
Well, in over my decade of experience practicing chiropractic, I've found more and more that the emotions that people are experiencing and the stress really affects them deeply.
Yeah, I think that's how we first connected on this subject, right?
Really on a neurological, in a neurological basis, where their neurology, their nervous systems, which controls everything that happens in the body, gets so deeply affected that they can barely function. And
so you're not the bone cracking kind of chiropractor in that traditional way where...
No. The work that I do is very gentle and very nurturing kind of and adjustments, but I also look deeper into the nervous system and look at things like stuck patterns sometimes.
Stuck patterns bodily or emotionally, or do they go together?
Exactly, they do go together. And I find that if their emotions are being affected, they can then affect the physical. People could sometimes have low back pain or neck pain, and really the crux of the matter, or the reason why they have that pain, is actually from an emotional reason, exactly, or event.
So if somebody comes to you and has low back pain, how do you get to this emotional revelation?
Well, I first assess their system. And I see them the first time for a longer visit where we really discuss what is going on. And in fact, I just had a patient come in who actually brought their daughter in and saw the care that the daughter was getting and said, wow, I want to be assessed and treated in that way. I need the help as well.
I want what she's having.
Exactly.
Yeah.
And I start with scans. We use some technology, and we scan the nervous system in a non-invasive way, but that gives us deeper information, again, to see where the stops are, where the stuck patterns are in the nervous system, and then we go and, in a very gentle way, release those patterns.
And how do you go, if you understand that it's really that a woman is coming to you, she's got 3 toddlers, she's got headaches, and you know that there's a lot going on in her life, how do you approach that? I mean, it's easier for me because I always approach things from an emotional point of view, but how do you then bridge the gap between the back pain, the headache, and the emotions?
Well, to start out with the scans, will show the places in the nervous system that have stress on them. But I also listen to her, and I also can intuitively sense through the analysis that I use which emotions are being affected, and then I ask questions. I make sure she's getting sleep, getting hydrated, different things that will show up as symptoms of deeper emotional problems.
I remember when we first talked that you said that sleep is almost number 1 in the problems that you see, that they just...
Absolutely. And so if someone's not sleeping, many times going to a therapist, someone like you, that will help them to sleep if they can release some of their tension in their mind. But sometimes there's so much tension built up in their bodies that they really need some physical work done and some
Yes.
deeper releasing, and that's the work that I do as well. And so I work sometimes with a therapist, sometimes I work with other practitioners to help this person to release these deep emotional issues that they're having.
And are your patients who sort of came thinking they were going to have their neck adjusted, are they responsive to the idea that they have a program that they should be following? And
Well, everyone's different, and I really try to meet my patients where they are,
right,
and find out what they want, because it's really about the patient. It's not about me and what I want for them, it's what they want for them.
following the patient.
So
yes.
it's a patient-centered view and a patient-centered focus and approach. So if they want to go there, then we talk about those things. Sometimes I'll bring them up and just suggest, I wonder, are you having this going on, or is there certain stress going on in your life? And then sometimes they will open up to that. Other times it takes longer for that to happen.
Right.
And we just work more on the physical aspects, which are releasing the emotional as well, because we're helping to reconnect that mind-body balance.
For the woman who's sort of shot out there among our viewers, sleep, hydration,
Yes.
what else? I mean, I know you're not prescribing for the multitudes, but just
Right.
sleep.
Even sleep is certainly important. Hydration, making sure you're getting water and absorbing that water. So making sure you have the proper minerals
I
and
see.
balance with nutrients. Also get fresh air every day. They talk a lot about vitamin D now is the
Yes.
big nutrient.
Right.
So, vitamin D we get from the sun.
Right.
Get out and
Right.
get some sun. Don't
Right.
put any sunscreen on. Go out, get
Right.
it. Fresh air really does change our mood and help us to feel better. Take a little walk. So it's really the basics that we've all heard, but they're so important.
So your philosophy is a long ways from the spine, as the chiropractic philosophy, that the spine is everything. You seem to be saying that what comes from the spine, all the neurological outgrowths is the spine. Is that kind
Yes.
of right?
It's the nervous system, really.
Right.
That is what chiropractors focus on. The bones house the nervous system.
Okay.
So I look at the brain, the spinal cord, and all of the nerves that come off of that. And that's the whole system that controls everything. So,
And this is different from the way you would have treated somebody 10 years ago.
yes, the emotional aspect, the fact that I get into emotions and stuck patterns in people's systems, that aspect of it was something that I always had felt was missing. That
Yes,
was
the
so
holistic
important.
part.
Exactly, so important to people, and what was really stopping them in terms of their health. That aspect I was not able to address at that point, and now I am able to address it and work with people like you.
I remember, I think we've talked about this once before, that Ida Rolf, the originator of Rolfing, was always surprised when people's emotions came out so dramatically after being manipulated, muscles were Rolfed. And they finally understood that muscles house emotion.
Exactly.
That you release the muscles and you're going to get people wanting to jump off bridges,
Yes,
So
exactly.
this is what you're dealing with now, this understanding.
This is a part of my work because, again, I try to meet people where they are.
Right.
Some people are not quite yet there, and other people want to jump right in and work on it.
For someone who wants to jump right in, how does someone jump and get you? How do they find you?
Well, I am in Danbury, across the street from the hospital, and I am...
Do you have a website?
Yes, I do. It's www.drmaratabares.com, which
All
is
one word?
all one, and it's DRMARATABARES.com.
Mara, thank you so much for coming on the show. It was really great to have you.
Well, thank you, Delma, for having me. Great to be here.